welcome to episode 56 of the Dental Realist podcast. I'm Dr. Ryder Waldron, and I'm here as usual with Dr. Marcus D. Neff and Dr. Troy Stevens. Marcus, how's it going tonight?
Oh, just happy to be at the end of the week. Very happy.
Good.
Yes.
Troy, what about you?
I'm the same way. I actually, it is 72 degrees outside right now.
Oh, it's too hot.
It's beautiful. I don't know why we're podcasting. We should be out doing something. Beautiful
First of all,
weather.
that's way too hot for April. That must be like an April Fool's joke. But
How warm is it over in eastern Idaho right now?
Over here, we're like 64, something like that. So a little cooler, but very warm for this time of year.
yeah, it says 64 here. So, that's probably okay. 72 at this time is getting a little too hot for my liking, but that's fine.
Hey,
Whatever.
Saturday, it's supposed to hit almost 80 here.
Yeah.
I cannot wait.
Kill
I
me
can't
now.
wait.
Me and my pale skin don't enjoy that much sunshine.
Yeah, I have pale skin too, and I've
Yeah.
had basal cell carcinoma, and I still
Yes, you have.
love
Now
it.
that's sun too much. Well, guys, how's your dental week been so far? I think we're all done for the week, aren't we, Troy? You're done. Marcus
Yep,
just said
I'm
he's
done.
done. I hope
Yep.
I'm done.
It's been an interesting
anything
week, I'll tell you
exciting
what.
this week? Anything exciting happen at your offices?
Oh man, I ended my day today. My very last patient of the week was a 10-year-old doing a filling on 19, an occlusal buccal. Sounds easy enough.
Yeah.
And then interproximal fillings on the mandibular anteriors. That was fun.
On
Yeah.
a
It's a
10-year-old?
good time.
Wow.
Yes, I know. I
God,
was like, people
really?
don't get decay interproximally on their lower anteriors very often. I mean, people do,
Yeah. Yeah.
but on a kid, I was like,
Yeah.
what the crap? And those aren't fun to do on an adult. Trying to do that on a kid to end your week, to end your night.
No, those are
Oh,
tough.
No.
that was. I'm
Okay,
just
so let me
filled,
ask you this.
filled with relief.
Let me ask you this, Marcus. How did you numb those up? Do you do like a mandibular block for those? Do you infiltrate on a lower anterior?
I did a mandibular block, did the long buckle. I did the whole works.
Wow.
I numbed that kid up.
I've taken to just infiltrating around those lower anteriors, and they get pretty dang numb. So
Yeah.
Yeah.
try to avoid that block at all costs. But
If I wasn't doing 19, I probably would have done that. I probably would have tried
that makes
infiltrating.
sense. Yeah, that makes
Yeah.
sense.
Marcus
Yeah.
made perfect sense in the reasoning why he did that. Are you trying to question him, Ryder?
Yeah, no. Without without 19. I mean, you throw 19 in there, that makes sense. No, I trust his defense of his treatment. You're he's not on trial here. Not with me.
I don't trust my eye judgment. I usually the whole time I'm doing dentistry, I'm wondering, am I doing this right? Is this the right thing to do for
Yeah, I want to talk about some of that a little bit later. Troy, how was your week? Anything exciting at your office?
Just some root surface caries on an elderly gentleman that was didn't know why he hadn't had a cavity in 30 years, but he hadn't been the dentist in 15. So
29 of them.
yeah,
Wow.
I know, right? It's kind of one of those things that's a little hard when you sometimes tell him you have cavities, and he's like, I can't believe I have a cavity. I mean, my
Yeah.
teeth have been so good. It's like, well, yep. But those root surface caries are so easy to restore too. I mean, very easy for access. They're down there so far. Getting a
Yeah.
good restorative material
Yeah.
down there that far and curing it is just easy.
Oh
easy.
yeah. And you usually have some nice inflamed gingiva to
Yeah.
deal with. I mean, you blow a little too much air from the air water syringe on there and they just bleed.
Yeah, there are those. Yeah. I can't figure out why my gums are bleeding. When was the last time you flossed? Well, 6 months ago. I mean, just like
Yeah,
everybody
when you-
else. No.
When the hygienist flossed me last time, I got flossed.
Oh my gosh.
know, right?
So I saw this thing it was on one of the local news websites here, and they did a March Madness of the best fast food joints in Utah. Do you guys have a favorite fast food restaurant? Not necessarily in Utah, but just overall.
Ooh.
I
Oh,
probably
tough
have kind of gravitated to Chick-fil-A over the last
Yeah.
several years.
That's a good one. Yeah.
I
I'm not a-
probably would say, yeah.
Okay,
Not a
Troy,
fun
you
thing.
got one?
Would Panera be considered a?
Yeah, we're gonna even go with the higher class option like that. Yeah,
Because I
yeah,
Chick-fil-A is right up there too. I love a
yeah.
Chick-fil-A, but and even back in the good old days of dental school when we had a Panera and spent
Hmm.
some quality time there because we went there to study.
Yep. Yeah,
You know.
Yes.
yeah,
Yes, indeed. Cinnamon Crunch Bagel. You can't go wrong there.
yeah. You
Oh
can't go
man,
wrong there.
Asiago cheese. Oh baby.
Mm. Yeah.
Yeah, and speaking of dental school, we used to go to Quiznos a lot. They don't have any Quiznos. I don't know if there's any Quiznos on planet Earth anymore, but
There
Quiznos
is
was so
one in
addictive.
Boise, but they went under. A
Really,
lot of them went under. Yeah.
There's still one in North Salt Lake, Ryder.
really.
Yes, I take my daughter to that volleyball place that's up there in North Salt Lake, and there is a
Yeah.
Quiznos.
Oh
There
my
is an
gosh, I had
actual
no idea.
Quiznos.
I had no idea.
You
There's
get
one in
desperate.
Jackson
Wow.
Hole, but Jackson Hole, I thought that was the closest one I had here. That's 4 hours away. So, okay.
Yeah, we had
Yeah.
several in Boise, and they went under, but there is one still lone survivor over there.
Wow. Okay. That's
Yeah.
interesting. That'd be about the only reason to go to Boise, right?
Yeah, there's no other reason unless you want to do
Uh,
something.
yeah, I don't know. So, well, this week, guys, I think I had 3 or 4 patients complaining to me about other dentists and dental work that they had done. And this seems to be getting more and more common for me. So I wanted to ask you guys how you would handle a situation like this. So my first one that I can think of was a guy who had a crown done on, I think it was 13, had it done 18 months ago. And it's been hurting ever since, he says. And he said that, previous dentist said it would calm down, which, usually they do. And, he told me that, he had two gold crowns for 30 years and they'd never given him any trouble. So he absolutely knows this other dentist did something wrong and was really trying to bait me into saying that this other dentist did something wrong. And I couldn't see anything that other dentist did anything wrong. So I was thinking about when Marcus said that, you question every time you're doing dentistry, whether you're doing it right. I do the same thing. And then so I hate to criticize somebody else's work because who knows, what happened that day and who knows who's seen some of my work and had a low opinion
Yeah.
of it. But this guy, it looked like a fine crown. So how do you guys handle situations like that? I've got some other examples that I want to talk about. How do you guys handle things like that?
Well, first off, I think it's interesting that people like we all probably do this to some degree at different times, but like especially with dentistry, it feels like they assume that because they've had a crown before and that one didn't hurt, that when this one hurts, that means there's something that was done wrong.
Yeah.
And I'm like, you just want to see that doesn't make logical sense. Like it could be perfectly done right, and that's just the way that tooth reacted. The circumstances are different. I mean, but anyway, that's just an observation that it's funny to me that people just automatically assume when something doesn't go right, it feels like they just assume that the dentist screwed up or did something wrong.
Yeah.
I don't know.
Yeah.
How many times have you had a patient that will come in and say, they need a root canal, and they'll go, "Oh no, I can't have one of those. The last one we had failed, and it did this and this."
Those don't work.
Yeah, I can't have a crown. The last time I had a crown, I lost a tooth. Blah 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 blah. They just assume that that's the case in every situation, where we're dealing with biological systems. Things react differently, like you're saying, Marcus. Was it fractured tooth? Was it decay? What was the reasoning behind, the trauma or whatever that caused the need for restoration anyway? It's a joke that they don't understand that, but layman people, of course, they don't have that knowledge that we have. But the way I approach it is I never throw another dentist under the bus.
Yeah.
I mean, there is no way I'm saying anything about anybody because I'm pretty sure there's some of my stuff floating around that somebody's, complaining about too. So,
Yeah.
And like you're saying, Ryder, you didn't see anything wrong. So,
I didn't. Yeah.
there's nothing that I've not ever seen anything really that so out of control that I would say, wow, this is really botched.
Yeah.
I would just say,
Yeah.
what? I don't know the situation of this tooth prior to him touching it or her touching it and doing it. Sometimes I'll just say that sometimes things happen like this. They happen to me too. I will actually say that so that I'll say, it happens to me too. I could try and change this filling out and you could still be in pain.
Yeah,
Yes.
that's totally true. And
That's
speaking of,
how I say it.
I'm the same way. I don't see a lot of stuff that's like just like, wow, what was that guy doing? That's just the worst thing I've ever seen. You'll see some root canals that are filled short, but I've also seen, done root canals that might be filled short. I have seen one. This root canal was done. I think it's on number 19, not by me, but and I don't know who did it actually. But there's some sort of silver point. And that thing, I'm not kidding, is out the apex by about 4 millimeters.
Yeah.
And the thing is, that tooth, it never gives this lady any trouble. I asked her, "Is that ever?" Nope, never had given me an ounce of trouble. So, who knows? Maybe that's the
Yeah.
secret. I don't know, but even the stuff that looks rough, it might still be functional, and the stuff that looks perfect sometimes hurts. I don't know.
Well, it's like Howard
It is
Franz said,
true.
you could put sterile bat crap in there and it would probably work.
Yeah, it's true. Yeah,
Remember
Probably
that?
would.
Remember what he
there's
said there?
no rhyme or reason to some of this stuff. So,
Yeah, silver points are
another.
good too. They never even taught us silver points. We never even
No,
learned
I
them.
don't even.
But I've seen
I
so many
no.
that are so still going.
Yeah, and it looks like they just pushed a straight pin right down the canal, and it seems to work. So who knows?
Something that I thought of as we've been talking here, I don't know that I do a great job of this, but I think I've gotten better at it over the years, is setting expectations with the
Yes.
patient when I do something. I used to when I first started practicing, I think I was a little hesitant to tell people all the bad things that could go wrong because I didn't want them to think I was like, oh my gosh, this guy thinks this stuff's going to go wrong. He must not
Yeah.
have confidence in what he's doing. But now I really try to paint a bad scenario,
Yeah.
not on everything, but on a lot of things. I'll just say, hey, look, like today, I did a crown on a lady who had an MODBL amalgam in number 19, and the mesiolingual cusp had broken off. I mean, there just literally was nothing left to do but a crown. Of course,
Yep.
it didn't hurt her at all. Tooth wasn't hurting her at all, but that's all that was left to do. I just told her, I was like, I know this tooth hasn't been hurting you. I know that it's a little rough and sharp to your tongue where it broke. Really, the only thing left to do is a crown. And there's a good chance by the time I have to take out all this old amalgam, cut this tooth back, and do the crown, it might be sensitive afterwards where it hasn't been before. But if I do nothing, you're going to end up at some point with an even worse situation. So, and whether that works or not, but I note it. I make sure I say that to the person, and then hopefully that at least sets an expectation so that, you know, today or a month from now or a year from now when it starts hurting, she remembers, oh yeah, he did tell me that was probably, there's a good chance that could happen.
Yeah, I like that, Marcus. I'm going to steal that from you. That is,
Yeah.
I mean, I couldn't deliver it quite as smoothly as you just did, but
Well,
that's actually great advice, or great, great instruction to the patient.
I've been doing that more lately. Do you mind if I share something real quick?
Yeah, please
So
do.
I
yeah,
had a
please do.
patient come in. Orthodontist has done what they can, and she has gaps between all the way 7, 7, 8, 9, and 10. Have you ever seen those where they have little
Yeah,
diastemas throughout there?
yeah.
And the orthodontist says they've done what they can, so they send him over for bonding over to the dentist, right?
Yeah.
I hate
Yep.
those.
Those are
hate
Oh
tough.
my gosh.
Yep.
They are
Those are rough.
so hard. So I
Yep.
spent 15, 20 minutes trying to talk this lady out of doing it. I said, is it bothering you? She's like, no. I'm like, well, then why are we bonding? What's the
Yeah.
problem? I mean, don't do it. Because I'm like going, the expectation is going to be off the chart. So I threw everything I could at it, just like trying to get her to do. I always said, veneers are going to be the best. Of course they are. I mean, I can get more predictable result.
Yeah.
But sure, lo and behold, she went up there and she scheduled those composites. I'm like, you got to be kidding me.
Yeah.
Even after trying to shoot her expectations out. So I don't know.
Yeah.
I don't know.
I do the same thing, and I've noticed that lately, if I have a deep filling on a tooth and I tell somebody that was a deep cavity, it got close to the nerve, there's a very good chance you're going to need a root canal. If it starts hurting you, that's the next thing I'm going to do is refer you to the endodontist for it. And I've had a couple of people call lately, and it's been, I mean, one guy I can think of, it was like a deep MO on number, or DO on number 3. And it was down there where, you can see the pulp horn kind of winking at you through the remaining dentin. And it's like, you just know it's going to be a root canal. And then you film, and anyway, the patient calls and, asks, what should he do? It's hurting, and, refer him to the endodontist, and they're fine. He said, yeah, that's what I thought was going to happen. So, they're good. But, If you
Yeah.
paint that rosy picture, then like, well, you said that'd be fine, and now it's not. And,
Yeah.
I don't know. I've heard I have a lot of patients say, Dr. So and so back 30 years ago told me that, when he did this filling, I'd need a root canal on it. I never did, and I guess he was wrong. Okay, well, I guess he was, or he was just like, lowering your expectations. So,
Mhm.
anyway,
Yeah.
interesting. Um, so another one another patient I had, it was actually a patient's mom was trying to kind of bait me into something. So this kid, he was a teenager that had a deep MOD on number 19, and then it was abscessed. And they'd gone to like a pediatric dentist recently, and they gave him some antibiotics, said he needs to see an endodontist. Well, they came to see me. I'm like, well, I'm going to send you to the endodontist. But, she was trying to say, well, I think that dentist drilled too deep. And we hear that all the time. The dentist drilled too deep. Well, you got to drill where the cavity goes, not, I don't know any
Yeah.
dentist that's just drilling on teeth for fun. The second thing she was asking is he had his wisdom teeth out, but number 31 had a fractured, like in the mesial marginal ridge was fractured off, and he had a one of those big occlusal composites in there, but he had decay along in the mesial, and she was trying to get me to say that the oral surgeon broke off that tooth. Like, nope, he sure didn't. That's
Nope.
aid right there. Neither dentist that you've talked about so far has done anything wrong. Then she was trying to get me to say, do you think if he had amalgams before that these would have lasted? Like, well, no, a big amalgam's the same as a big composite. The filling didn't break, the tooth did. So, I get nervous, or not nervous. I almost get, I guess, annoyed when people are trying to bait you into saying something bad about another dentist.
Yeah. And don't you wish those people would just go somewhere else? I mean,
Yes. Yes.
and probably the guy
Mhm.
who they were last at is probably going, sweet, they didn't reschedule with me.
Yes.
Hallelujah, they're gone. But
Yeah.
Yeah.
I swear, sometimes they'll find you, like they find me anyway, and I feel like they just keep hanging around, and I'm
Yeah.
like, oh my gosh, you question everything, you blame somebody else all the
Hmm.
time, but here you are, you just keep coming back to me.
Yeah.
Yeah, they never
Yeah.
take any personal responsibility for their own flipping teeth. Like this kid sounds like Ryder that, he sounds like he's not a real big heavy brusher,
Not
and
great.
that's going to be that's the problem. And you kind of want to say that, but you really don't feel like you can because you don't want to, you know, unfortunately we need to have people coming back. We have to be at least nice about, dismissing them or whatever, but
Yeah.
Right.
Yeah.
the reality is,
Yeah.
use the brushy side of the brush, floss, and you're going to be just fine. The
The
problem with your
brushy side
kid's
of the
teeth,
brush.
yeah, if you're using the plastic side, you're using the wrong side. But you can't say that to people because you don't want to belittle them or anything like that.
It's
But the
true.
reality is, your kid is not brushing his teeth. That's what broke your kid's teeth.
Yeah.
I mean, you talked about two teeth there. 19 was large, 31 was large.
Yeah.
Look, this is a problem with the kid, not a problem with the dentist.
Yeah. That's
So,
exactly what I think. And you always, you hear these nightmare stories about this dentist did something wrong and he destroyed my teeth. And like, I don't know that I've seen many cases that, or if any cases where that has happened, but you sure hear
Yeah.
those stories of people telling, or the people have told. So,
Hmm.
it's their
yeah.
perception of it. It's their perception, and they got to blame somebody because they can't blame themselves for not taking care of their teeth. If a
Yeah.
person never got a cavity, you would never have to do a filling, right? So
True.
it's if they
Yeah.
would
Yeah.
brush and floss, we would never have to touch their teeth.
And we would prefer that probably.
Yes.
I don't have a
I think,
problem telling someone they don't have a cavity. I don't. That doesn't bother me one
yeah.
bit.
I really enjoy the patient that comes in with kind of something aching and, I can't see anything wrong. And they're like, okay, well, I'm fine not doing anything. I just want to get it looked at. Okay. We're best friends now because that's awesome.
Yes.
On the other
There's,
hand, how refreshing is it when someone comes in and says, "Yeah, I've been neglecting my teeth. I knew this was happening,"
yeah,
and take total responsibility.
yes.
Yep.
That's
Yeah,
refreshing. You're like, "Yeah,
it,
you're
it
right, and
is.
let's get you fixed." And I actually like helping those people.
Yes.
I love it.
Yeah.
Yeah.
That's an excellent point, Troy, because yeah, you get those people that come in and they know they're going to put some money into their mouth. And it seems like most of the time when I see those people, they're just dreading it, they think it's going to cost a lot. And then it's like, oh, that's not as bad as I thought. Or, they don't need as much work as they thought. They're usually pleasantly surprised. But these people that come in and think they have nothing wrong, they've had this immaculate home care, and then it's like, yeah, not really. And they're, yeah, anyway,
Yep,
Yep.
absolutely,
interesting.
absolutely.
I had one patient that he's missing a bunch of teeth and everything. He called it a mouthful of torment, and I really like that term because it's just kind of descriptive of missing a bunch of teeth, a bunch of decayed teeth everywhere. And I thought, yes, excellent.
Mouthful of
So,
torment.
yeah,
One way to put it.
yeah, that's good. Okay, I've got something else I want to ask you guys since it's getting close to graduation time for dental students. Somebody asked me the other day if I would go, if I could do it over, if I'd go to dental school again. And I know we've talked about that on this show before, and I had to think for a minute, and I said I probably would. Maybe I would, but I would want to ask some questions before, because we've talked about how, we'd go to dentist's office and they'd always paint a rosy picture. The staff seemed awesome, patients did. So I thought there's a lot of questions I would want some more in-depth, honest answers to. But for people coming out of dental school right now, they're going to be joining practices or purchasing practices. And I was trying to think of questions that, the average dental student may not think to ask somebody whose practice they're joining or practice they're purchasing. So would you guys be interested in talking about that for a minute?
Yeah, let's do.
You
Okay.
bet.
So, something I thought, for somebody that is buying a practice would be, is the staff going to stay on, and then find out some benefits and things like that. What are some other things that you guys think would be important to ask either the selling dentist or, the owner dentist that you're going to join their practice?
I'd probably ask some questions around recall, hygiene, that type of thing, just to get a feel. How many patients are actively coming back in and returning to the practice like every
Yeah.
6 months, or what percentage of the patients are receiving periodontal treatment. You know, and last time I think I looked, the national numbers were somewhere around 30% or something like that of
That
people have
seems right.
perio.
Yeah.
So if you looked at a practice and it was way lower than that, you might wonder, or is there an opportunity there, or is that going to be a challenge? I may have mentioned this previously on one of our podcasts, but when I left my private practice and I tried to merge with another guy, one of the things that kind of put a big put a big damper on that merger was right out of the gate. I noticed that they did hardly any perio treatment,
Hmm.
and so they were having a staff meeting, and I brought it up, and those hygienists looked at me like I was the devil for even questioning that they weren't that they weren't doing SRP or perio maintenance, and there wasn't an
Oh,
opportunity there. Maybe we should relook at things. Um, so, I mean, that kind of goes back to asking questions about the staff too. How long have the
yeah.
staff been there? And so I don't know. I don't know if that was a question that I would ask so much as something to something to think about.
Yeah, no, that's good because yeah, I've seen those practices too, and that, you got to think that some percentage of patients have got to have some perio in there, but yeah, anyway, that's a good one. What about you, Troy? Is there anything you could think? I mean, there's probably a million things, so we can go through all of them, but what comes to mind at first?
Well, there's a couple things that come to mind when you ask the question. First of all, as we have seen, as we have looked at this practice that we're possibly going to acquire, um, is the reality of the fact that some people can't afford to buy an office. That's one thing. Okay, so if
Yeah,
someone is buried in student loan debt, they can't buy a practice. It's going to be very difficult for them. We're looking at a practice where two people have been declined because they have too much debt. So I would caution any new dentists, any students to look at that and be very aware of that. It seems like banks may be tightening down just a bit. Another
yeah,
thing is I would ask what procedures they are referring um, versus keeping in house. Like, I refer all molar endo, I refer surgical extractions, all wisdom teeth. And now that we have another guy that just came in and has partnered with us, he does that stuff. So that has helped keep that stuff in house, has absolutely benefited the practice overall, helps patients because patients don't have to, go to the specialist or whatever as much. I mean, occasionally will still refer depending on the case, but those are some things that I think is a real big practice booster is if a dentist is not doing something that you enjoy doing, and they're referring that, that's something that you can count on as helping generate more revenue and taking that into consideration. On the
Yeah,
other
that's
hand,
great.
it could go the other way. Like if he's doing IV sedation and placing implants and you don't want to do that, you're going to lose that revenue as well. So something to consider.
Yeah, that's excellent. I think that's really important because you get into a practice and you don't want to do any molar endo. And so, well, Dr. Stevens used to do those. Well, maybe I'm not as good as Dr. Stevens. I don't know, but yeah, so that's important to have kind of the same practice philosophies. Um, I was thinking about things like the last time there was a fee increase, because if
Hmm.
the seller hasn't increased his fees for 10 years, and then you buy the practice and he's charging $500 for a crown, and really in your area it should be 900. Well, you're going to look like a criminal, trying to boost up the price of procedures that fast or that much. So looking at fee increases, if patients expect it every year or whatever, then that's one thing. But so I thought that could be kind of risky. But um, trying to think of some other things, whether or not the seller is staying on, how many new patients each month, because you were talking about that practice, Troy, and like getting 6 patients a month. That doesn't seem even enough to keep a practice alive
No,
Yeah.
nowadays. And so
that's for sure. The one thing like Marcus brought up, the staff, man, that's huge. If the staff doesn't like someone who's buying the practice,
yeah,
they aren't going to help you build that thing back up and say good things about you. They're going to start going, yeah, Dr. Jones or whatever, he's okay, but he's not Dr. Smith, who is the original owner. And I've heard of a lot of problems with those types of practices where someone has to come in and really start over and get all new staff and start a whole new philosophy, because like Marcus said, you got a situation where the guy's not diagnosing any perio and you're going, we can't do that. you know you're going to have a hygienist mad at you, you're going to have patients mad at you. I've been going to Dr. Smith for 20 years and he never told me I had periodontal disease.
yeah,
When we acquired a practice here in town, we had a ton of people leave because of that.
hmm,
um,
Yeah.
because when they came over, the hygienist did not like the root plane. And the doctor said that he didn't want any of his patients to feel any discomfort whatsoever.
hmm.
For
So,
their cleanings. Yeah, I gotta be.
yes. And so it's like,
Wow.
well, I understand that we don't want to hurt them. We don't want the discomfort. But on the other hand, what are we going to do when we're just ignoring disease? So,
Yeah.
Yeah.
and patients really don't want to hear that. If they've been going to that dentist for that long and you come in, you buy the practice and you start diagnosing a bunch of stuff, boy, oh boy, that could be tricky.
Yeah, and that's a good point, Troy, because we have like I guess, a legal, ethical obligation to tell them you have periodontal disease, and if they don't like it, that sucks because they might go to another practice. Usually the way I feel about that is if they leave because of something I diagnosed correctly, they're probably going to go to this other office and they're going to tell them the same thing. So at least that would confirm, what I told them. But when
Yeah.
you guys were talking about the staff, I did have a situation when I bought my practice. The front office lady, she was not on board with how I wanted to do things. She liked to schedule out of a book still. She paid, well, she didn't. The dentist who was my father-in-law, who I purchased the practice from, he paid for a billing service to send out bills. So mostly she didn't do a whole lot of anything, and she did not like that I wanted to update with computers and have some software to schedule and send out bills, and she was not on board. And I bought the practice on December 1st, and in January some patient came in and she said, this is not the practice you want, or not the office you want to be coming into right now. Like, you've got to be kidding me. And so
Wow.
she sat me down. Her and her husband wanted to have a talk one day after work, and they gave me the ultimatum: if either we go back to the way she was doing things with the book and this and that, or she would be quitting. So it took like 2 minutes for me to make that decision. I said I would think about it, to be polite, but I couldn't have been more excited. And so I told her, I'd let her quit. And she said, okay, when do you want me gone? And I said, I think this was a week later. And I said, right now. And she was like shocked. She thought she was going to get like a couple of weeks and this and that. But yeah, so staff support can be huge. I mean, it can
Oh
make or
yeah.
break you, I think.
It can for sure. And it's interesting too, like what Troy was mentioning. If you're going to start diagnosing perio and it hasn't been being diagnosed in the practice, or you're going to, any number of things that maybe weren't getting diagnosed, I think it's important to try to work through some wording or some language. There's lots of coaches out there that probably offer that. You can probably find lots of free
Yeah.
stuff out there too that just but it really can make a difference if you and the team are using the same language and you're presenting things with the right words and in the right way. It goes a long way for patients to accept what you're saying and to buy into the new philosophy and the new approach.
Yeah.
But vice versa, if you're just winging it and you're not sure what you're going to say and everybody's saying something different, you just end up with less credibility and patients are doubting and it can be a mess. So it's worth taking the time, maybe even paying somebody to give you a little coaching on how to say things, how to word things.
Yeah, I think that's really good. I think patients pick up on if there's any tension in the office, or if the staff doesn't have a lot of trust in the dentist. I think they pick up on that pretty quick. And
Yeah,
I think they probably pick up on if there's a lot of staff turnover. But sometimes when you buy a practice and if the staff isn't on board, I mean, what else can you do? You can't, no amount of money is going to get them to trust you more or support you more. So it might be just time for a fresh start with some other
yeah,
staff members. I don't know.
for sure.
Yeah. So, Troy, you just sold part of your practice to, like you said, to that new associate. Well, he's not an associate. I guess he's an owner now.
Yep,
What
partner
were some
now.
questions he asked you about the practice initially to kind of get interested in it?
Well, he worked with us for a few months as an associate. We shared
Oh,
everything
okay.
with him, as far as that goes. And we went over the same things we just discussed, like how he did IV sedation. We didn't do IV sedation. He likes to do extractions. I don't particularly care for that. He does some molar endo. I just don't have any desire to do that. So we kind of went over those things and, found out that he was going to be a great match and ended up working out really well. I mean, he's young, handsome. The staff thinks he's awesome,
Wow.
Terry and I are a bunch of old guys now, and we're just not as we don't look as good as we used to, and so getting a new look in the office has helped our staff, the morale and all that stuff too. So
Wow. Okay. So the key is to hire a handsome dentist. All
there you
right.
go. That's what they're
There
saying.
you go. And if you're graduating and you're not that attractive right now, you might want to think about getting more attractive because then maybe Uh, yeah, that's good. I would love to have somebody like that in my office. Not somebody that's like that handsome. I don't want them better looking than I am, but somebody that can do the implants and IV stuff. Because you know you think about how much endo. At least if I think about how much endo I refer out, how many wisdom teeth extractions, things like that. I mean, that's a huge boost to the production bottom line if you keep all that in house. That's
Yeah,
amazing.
I
Yeah,
mean that's a great point, Ryder. It's been huge for us. I mean, it almost covers the additional doctor fee because
Yeah.
we
Wow.
we referred a ton of that stuff out. It just got to a point where my other business partner and I, we just got kind of, I'm not going to lie, we got a little lackadaisical and we just got doing what we want to do and what we didn't
Yeah.
want to do, we referred,
Yeah.
and, uh, and having a new, fresh perspective on things and someone who enjoys doing that kind of stuff, then, it's been very, very beneficial.
Nice.
And it
Well, do you
helps
have any
track
other?
patients. The IV sedation thing, which I have zero desire to do,
No.
has been really nice because, he does wisdom teeth. And so, uh, definitely a benefit for folks who want to be sedated for stuff. Um, which
yeah,
if you like that stuff, then do it. Some
Yeah.
dentists love to do it, some people don't. It's like
Yeah.
we've
Sure.
talked in the past. The more dentistry I do, the less I like it.
And it's true that you feel comfortable doing what you're doing. And I used to think that I don't do a lot of molar endo. And you hear the other dentists, oh, I do every second molar I can possibly do. I'm going to do the endo on it, and I love to place implants. I love to do this and that. And I thought, God, maybe I'm like a lesser dentist, and I've got this rinky-dink practice and not doing all that. But then, um, I hear of general dentists placing implants that fail or endos that, doing endos that fail. And I think, yeah, it's probably better just not to have that stress. And if you're busy doing other stuff, why not do what you're good at? So
Yeah.
Yep.
I don't think anybody that doesn't do that molar endo and that stuff needs to feel inferior at all. And if you like doing
No,
it, that's awesome. If you're good at it, great.
that's really what it boiled down to, Ryder. Exactly what you said. I was busy enough doing the other stuff that I didn't have to do it.
Yeah.
I was making
Yeah.
enough. I was doing fine. I'm like, why incorporate more into my repertoire that I didn't really need to. I wasn't looking to grow the practice per se. Where we are now, where we have another dentist, of course we want to grow it now. But at the time, I was like going, I was kind of on cruise control. So
Yeah,
Yeah.
and you figure you could probably prep 2 crowns in an hour or an hour and a half. I mean, to do a molar endo, it might take, two 1 hour, 1.5 hour appointments or something like that to get that thing done. So, production wise, that's just not worth it. Not to
yep.
me, but whatever.
What's the most cost effective thing we can do in dentistry?
I think it's got to be crown and bridge, but I don't,
Two
maybe,
surface composite. It's composites.
really?
Think about it, because we don't have any lab costs.
Oh, yeah, that's a good
It's
point.
true too.
It's done, and you don't have to have a
Yeah,
patient come back. You don't
that's
have to have them
true.
come back. So
So if you
that's
do that,
what I have heard anyway. I mean, I haven't nailed it down, that tight as far as financial stuff goes, but
well, yeah, that
composites
could
are
be true
some of the
because,
most lucrative things we can do, because we can just fly through them, be done
yeah,
with them, and you don't have a lab fee, and you can just get her done.
huh, didn't even think of that.
No
Yeah,
more chair
because
time.
yeah, no more chair time, no coming back, no impression material.
Yep.
Yeah, you're probably right. You can do one of those in one or two in, half hour to 3 or 4 in an hour or something like that. So yeah,
Yeah.
that's a good
Yeah.
point.
If you're doing a quadrant, if you're
Yeah.
knocking out a quadrant of composites, that's a fair amount of coin.
Yeah.
What, your patients pay you in coin?
No, but and the
Bitcoin?
insurances don't pay us either, so that's a problem. I
They
mean,
actually
in
give you
theory,
coins.
let's put this in theory, you could do more, but
Yeah.
the insurance will tell you how much you can make when all is said and done anyway.
Yeah, it's unbelievable. It's unbelievable. We've had several discussions on that. So,
Yeah.
um, any other advice you'd give to people thinking about buying practice? Any like simple questions you want to throw out there? Um, I was thinking of things like where do the new patients come from, what the demographics are of the patients. If you're joining a practice, you want to know what the pay and benefits are. I know pay seems like this thing you should never ask about, but you got to know how much you're going to get paid.
Kind of important.
Um,
Yeah.
it's kind of important. I also thought I would like to ask the seller what they don't like about their practice. See if they give you an honest answer about something like that. Like, what do you really not like about it? What would you improve if you could? So, I don't know. You guys have anything else before we wrap things up here?
No, I do like that, asking them a question like that, because if they just give you the pat answer, oh, I love my practice, my patients are so great, I love my staff, I'd be a little leery, because nobody's practice. I know we've talked about this before, but in the dental world, we all tend to just blow smoke at each other when we
That's
run into
true.
each other at
Yeah.
meetings or wherever it is. How's your practice?
Everything's
Oh, it's
perfect. Everything's
great.
perfect.
Everything. Oh, yeah. So if
Yeah.
you're looking at actually buying a practice, you want to ask it might be good to ask a question like that and see what kind of answer you get. Because if they just give you oh my gosh, it's the best practice ever, patients are great, production's awesome, you might be a little leery. You might want to dig a
Yeah.
little deeper.
Yeah.
Great points. That's
Yeah. Excellent.
fantastic.
So this might date the show a little bit, but who do you guys have winning the Final Four this year, this week?
For final what? Final.
Yeah. Final what?
College basketball. Come on. The Final
Oh,
Four in college hockey. Who do you have?
are we talking the women's tournament?
Nope. No, that's going to be UConn because they just win it like every year for the past 50 years, it feels like. But let's see. We have Gonzaga playing UCLA,
I'll take the
Baylor versus
Jazz,
Houston.
Utah Jazz.
Marcus, I'm
I'll
sick of
take the
this
Utah
Jazz. You
Ute.
putting the Jazz down. The Jazz have the Jazz have the
Did
best
they not
record in
make
the
the
NBA.
NCAA tournament?
Their third string could win the NCAA tournament, Marcus. And when they finish with the best record in the NBA this year, you're going to be sorry.
Hey, look, I'm actually cheering for the Jazz to win this year, because I these teams that just buy up superstars and all
Yeah,
these
yeah.
aging veteran superstars that just jump on board, and I'm like, I don't want them to win. So,
I
but
agree.
getting back to the NCAA, I don't see Gonzaga like losing at all.
I don't either.
There's, if they do, it's going to be shocking.
Yeah, they're steamrolling people. Troy, you got a pick?
If you didn't tell me Gonzaga right there, I wouldn't even have known that they were in the Final Four. I've really followed it about that much. I don't even know which teams are in it.
That's our boy right there.
I
That's what we
don't
wanted to
follow
hear
it.
from.
I just don't. I'm sorry.
No, no need to
What
apologize.
what about? Is there a gaming tournament or something that maybe you're keeping tabs on, Troy? Like
Well,
online
I have
gaming?
Yeah.
Or?
I have upgraded my flight simulation hardware lately, so I
Well, that's
actually been
good. That's
considering
awesome.
getting my private pilot license again, but I still need to convince my wife I need to do it.
You
I'd like to
do.
buy a little airplane and buzz around. That would be a blast.
That would be
Um,
fun.
so speaking of our favorite team, the Utah Jazz, they just had a little brush with well, I don't want to say brush with death, but I mean they their
Yeah.
charter hit a flock of birds, possibly a flock of seagulls, not the band, but on takeoff a couple of days ago and had to turn right back around and land in Salt Lake. They lost an engine and engine blew out and everything. So I guess it was pretty scary. So
And that's a little
close
weird
call.
because I thought in Utah the Seagulls saved the day back in the day when the
Well,
Pioneers came there. And isn't
yeah,
that the state bird?
it is the state bird because they ate all the, I don't know, beetles from eating the crops or something like
Crickets or
that.
something, yeah.
Yeah,
Crickets.
crickets
Yeah.
probably. I guess a cricket is a beetle. I have a degree in zoology and I have no idea. But
Yeah.
you know, the seagull is kind of, in California, I think it's just like considered a garbage bird. And our state bird is the California gull. How stupid is that? We can't even pick our own native bird. So anyway, wow, this this show's really taken a turn. Um, Marcus, why don't you tell everybody where to find us if they haven't turned us off already?
You can send us an email to dentalrealist@gmail.com. You can check us out on Twitter. I think we have a Facebook page, don't we? Yeah.
Not that I manage, but you're supposed to be on top of that. I take care of the Twitter.
That's right. Get us on Twitter. Writers on top of that.
Yeah,
You might be
we're
able
on
to find us
LinkedIn
on
and Twitter.
Facebook.
If you go to LinkedIn and Twitter, I'm on top of that. You go to Facebook, Marcus hasn't posted in 6 years, but
Who
that's okay.
knows? uh,
You might get
we've got a
something.
couple of great books. We'll do a shameless plug for those.
Yes.
So you want to be a dentist is one of them, and so now you're a dentist is the other. Both really good reads. A lot of packed full of really good information. You can find those anywhere fine books are sold because it is a fine book. Both of them.
It is a fun book.
It's a
You won't get
quality
any
item.
jazz trivia. No jazz trivia in that book or either one of those books, but you have to come here to get that. So, Troy, do you have anything to throw in at the end here?
No, I mean we other than the basketball, that just ruined it. We should just start over.
Yeah, we should probably edit that out, but we're not going to. We're going to leave that in.
Yeah.
So when the Jazz win the
I used to
championship,
follow it, but I just don't anymore. So
well, we'll get you back on that Jazz bandwagon. So
yeah, I like it when they do.
anyway,
It's fine.
what's that?
I like it when they do well. That's
And so does Marcus, because the Celtics are below 500 the last I checked.
Yeah,
Terrible.
they
Yeah,
are.
proud, once proud franchise fall to those depths. But anyway, this has been episode 56. We appreciate everybody listening, and we will see you on episode 57. Thanks.